Hi, my name is Victoria Gertz. I am a pineapple therapist. And so thank you all for attending my webinar. And thank you, Pineapple, also for having me. I'm going to share my screen so that you can see the slides. So the title of this webinar is The Impact of Systemic and Internalized Views on Adult Performers in Dating and Relationships. This session is particularly important for me because I am a industry veteran. I am also, so other disclosures, I'm employed by the Los Angeles Sex Therapy Collective. I also identify as bisexual, and I'm also second generation Mexican American. And I also wanted to do a land disclosure to make sure that, so from where I'm presenting is Los Angeles, California, and currently I'm on occupied land, originally and still inhabited and cared for by the Tongva, Tatavam, Serrano, Keys, and the Chumash people. All right, and then I also want to have these disclosures as sort of a, like these are these evident truths that will be present throughout the presentation. So one is sexual wellness and health, is that is defined by the ability to seek out and identify one's own access to pleasure and intimacy through one's own level of interest. It is not defined by the ability to participate or the amount of interest in the sexual activity. People have the right to pursue any and all sexual activities if they are all consenting adults. So that also includes non-monogamy, fetishes, and kinks. And also that we're all diverse and expansive, and gender, physical sex, and sexual identities can shift, change, and develop through a lifetime. People who are gender and sexual diverse are deserving of sexual wellness and also health. And so these are some of the objectives that we're going to go through in the presentation. The first is exploring how our societies have had long-held views and systemic practices and ideologies that shape the dating and relationship practices of BIPOC, LGBT, and transgender gender nonconforming adult performers and erotic laborers. Our second objective is providing guidelines for working within these confines and working towards dismantling both internal stories, shame, and trauma, and learning how to practice self-care when dealing with others in the dating realm. I'm also going to be bringing a lot of my own experiences, personal experiences of being a veteran sex worker. So hopefully we're also going to hold space for that as well. All right. And then this is the agenda for today. The first one is going to be dismantling the hierarchy. So analyzing how the oppression model creates more shame and further creates re-traumatization, and also the criminalization of BIPOC, LGBT, and TGNC bodies, identifying protective factors through an intersectional lens. So we'll be creating safety nets or understanding how safety nets and activism is created within our community, understanding why we feel shame and stigma more often than other populations. And the last part of the agenda will be learning how to regulate the nervous system. So doing a body scan at the end as well. And I'll save the end of it for like any resources, questions, and also the references that I used in the presentation. So hierarchy. Hopefully some of you have heard of this before. If you haven't, what is it? So there are different ways to describe this. Is the idea that one form of sex work is better than the other. There are different ways to describe this. Oftentimes, OnlyFans creators or cam girls are on top because of the preventative access to direct exposure to people. Other times, escorts are on top because of the privacy and secrecy of their work. Street workers are usually labeled at the bottom due to their visibility to the outside world, their access to direct exposure from clients, the proximity to police, so the increased risk of criminalization, and also lack of preventative healthcare and systems. So in reality, there is no better sex work. But it is also antiquated because in reality, sex workers should be united, whether you're a cam girl, an escort, street worker. The work we do is complicated. It comes with risk, and there's benefits to all levels. In reality, dismantling of this hierarchy is necessary to also dismantle the negative bias and stigma we have sometimes of ourselves and also of others. And marginalized communities are faced more often with having to disclose than white cisgendered females who are in the sex work industry, unless they are in the adult performing industry, such as like cam girls or in or in other forms. So unfortunately, to understand the creation of this hierarchy is also important to understand how the intersectionality of privilege in certain people enforce these ideologies. So we have the 4 I's of oppression. The first one is ideological oppression. This is the idea that one group is better than the other group. Then we have institutional oppression, which is the systems that uphold ideological oppression, such as schools, jails, mental health organizations, and workplaces. Then we have interpersonal oppression. So this works like in relationships, whether that be friendships, within family, or even when like dating, in which one person thinks they are better than the other. This can be due to bias, racism, or any other form of prejudice. And then the last one, although it is not mentioned as one of the 4 I's of oppression, is the internalized privilege. This is sort of like what upholds the other 4 in a sense, because the people who have internalized privilege don't do anything to really break or also advocate for the people who do experience these. So people who benefit the most from these systems have internalized privilege. Oftentimes they are unaware or they're in disbelief of the suffering of other folks. And I know for sure that I did benefit from internalized privilege, especially when I first entered the industry. So although I am a 2nd-generation immigrant, I do identify as Mexican American and queer, am able to pass and pass off as being white presenting or even heterosexual. So this is on our right, we have hopefully some of you recognize these people. On top is from the movie Sessions. Then we see Julia Roberts from Pretty Woman. And then the bottom is from the movie The Courtesan. So media also glamorizes white women in the industry. So these structures of oppression, such as the hierarchy, it distracts attention from those who need support the most and enforces the attitudes that prevent them from accessing the support. Media and also these internalized beliefs of self further perpetuates the whorephobia, the stigma and shame. Oftentimes, if we are part of a marginalized community, choosing to hide our identity is ability for us to get more clientele, to get increased cash flow, and also change how we are perceived or what gets said to clients. And then furthermore, many workers within the industry can sometimes also supplement their income with other forms of sex work that does also become scrutinized. There's this message that you will always be someone's type, yet a lot of that message is geared to more Eurocentric beauty standards or those who are college educated. I had lots of friends also worked at strip clubs, so there was discriminatory hiring practices. So at these strip clubs and also like in fetish dungeons, where they would reinforce the hierarchy through like hiring quotas on Black or darker skinned employees, but not essentially for white employees. Um, and then, like I mentioned before, since I did present as racially ambiguous, when in the beginning of when I was in the industry, was able to present and shape myself into what I imagined the client desiring. So either by lying about my ethnic background, or about my sexual orientation, whereas other people who cannot lie um, do face more of these limitations within the workplace, even within the work itself. And this policing of spaces further limits the space that hyper marginalized workers have access to. So why am I explaining and why am I kind of going over structures of oppression? Why am I discussing this hierarchy? The reason why I do is because of the shame and the trauma that kind of comes with it. So oftentimes there is rejection from family and friends. There's a codependency on drugs and alcohol to cope with external factors such as with dating or rejection and shame. With transgender and gender nonconforming bodies, there's this also separate level of shame that comes with how we feel with our bodies. Um, Sometimes even this shame and trauma can add an extra layer of risk, such as sexually transmitted infections. So during my time when I was working in the industry, I did get a couple times I did receive chlamydia, and other times I was in this other time I was diagnosed with herpes. So that added a more kind of like another layer to how I presented to myself, and especially with dating. It was already really difficult to express that I was a sex worker, and then to also, on top of that, add with another layer that I also had herpes, or that I continued to have herpes. So we aren't really trained on how to disclose these sort of things with potential partners and also with clients who presumably give us the infections to either self-preserve our business, ongoing relationships with clients or our workplaces. And then growing up in a Mexican American household, there was this, besides the historical and also cultural factors, traditional gender norms of normalizing intimate partner violence with our work and sometimes also with our identities comes a extra layer. And I wish I could talk about this more with intimate partner violence, since it's something that I do speak a lot with my clients in therapy sessions about. And I myself also had to go seek a therapist for to also seek healing. But this intimate partner violence, although it's not talked about, it can also lead to a host of other issues, such as chronic health issues and mental health issues as well. So these are some questions I use to ask surrounding shame. I usually ask my clients, what was the impact of having to hide your sex work? What messages did the withdrawal from like potential partners, family, friends send to you? What aspects of you do you think people perceive as inferior? Have you perhaps paired fear with finding love? Do you worry about rejection? When did you first start to anticipate rejection? What did you do? What was your behavior? Who do you get to be? And what kind of sex do you get to have when you are dating and in a relationship? And these questions I ask because we don't usually see how shame and stigma really comes up in our bodies. Aside from the internal aspects of it, there's also the external aspects of how our relationship with our bodies and also with dating other people. And An additional question that's not on here, but is another question that I would also ask is, what is your relationship with alcohol and drugs when dating or in relationships? I'm a supporter of people who do use alcohol and drugs, but are we using them safely? And what are the consequences when we abuse them or use too much? So these are just some limitations, right? So within the United States, we have policy changes such as Roe versus Wade, and this severely impacts how care is accessed in rural and cities. Um, More often than not, these small clinics were also paramount in providing accessible and preventative care for marginalized communities. It also provided a safe space for when dating and getting STI checks, and also just safe space in general to disclose other traumatic events. And then we have systems in place. So too often poverty, language barriers, lack of transportation, housing agencies, fear of deportation, and or the mistrust of medical community can also interfere and threaten our existence. So how we hold ourselves in this space um, can also interfere with seeking relationships and how we date. So I've identified some protective factors within the community and hierarchy because as much as the oppression model is there and as much as systems are in place to oppress us, uh, we it is also important to also see how our intersectionality is also existing in other spaces. So like the mental health field, the healthcare system, we all come with increased access to knowledge, wealth, and community. When it comes to dating, we can provide each other the support and access to self-care that we need. So the industry can also be a coexisting space for mutual aid, harm reduction, and safety. Queer communities, we view sexuality different, and we've sort of kind of like made up the rules when it comes to sex and sexuality, such as exploring kink, being in polyamory or being in polyamorous relationships. Uh, there are many occupations where it is completely normalized to sell our bodies for money, such as being a model or being an athlete. So if we're viewing certain professionals as more worthy of respect than sex workers, then this is where we see whorephobia, racism, homophobia, etc., likely becoming at the root of their belief system. And I have these two quotes here. Um, I had the quote from Bell Hooks on the previous slide, but I also have it here as well. This first quote by Bell Hooks states, "All too often, women believe it is a sign of commitment, an expression of love to endure unkindness or cruelty, to forgive and forget in actuality. When we love rightly, we know that the healthy, loving response to cruelty and abuse is putting ourselves out of harm's way." And that's from her expert, All About Love, New Visions. And then we have an excerpt from Sonia Renee Taylor. "A radical self-love world is a world that works for everybody. Creating such a world is an inside-out job. How we value and honor our own bodies impacts how we value and honor the bodies of others." So radical self-love gives us the opportunity for us to realize that we are incredible beings and that we deserve love. It also models consent and empowers us to set boundaries. Uh, it gives us permission to do so as well, by even using non-judgmental language. Um, Addressing sexuality as normal component of love and care is a indicator of quality of life. Contrary to what systems of oppression and marginalization want us to believe, we are interdependent beings, and our individual experiences impact one another. So while self-love starts with us as individuals, it also has the power to expand to our own families and communities. It also has the power to transform our societies as whole. And we cannot change the world without the foundation of love. So that's why we must show up with love as an action to the world. It also, uh, when we're speaking about this action radical self-love is to also recognize that we have ancestral ties to our community, to our to the earth, to the places that we live in. And by practicing radical self-love, we're also practicing homage to our ancestors who brought us into these spaces. So I'm going to press play. This is an excerpt. Oops. I wonder how I can press play. If it lets me. This was from Sonia Renee Taylor. It was, she was presenting in St. Paul, Minnesota in a poetry event, but I don't think I can press play. Yes. Sorry, I should have probably I should have probably seen if this was going to work beforehand, but I assumed it did when I went through it before. But it's fine. We don't see this. If any of you are able to go on to YouTube, she has lots of these beautiful messages and also poetry excerpts from her works as well. I'm curious about how you and others respond to partners that express an insecurity about a trick, buying you out of the primary or other relationship that you have for pleasure. Is this in terms of like being in a non-monogamous relationship, or is this in terms of having a partner trick you out of from being in the industry? I'll wait for your answer. Again, at the end of the webinar, I'll be answering more questions, so then I can probably understand a little bit more about this question. All right. Depression and anxiety. So pleasure is the measure, whether we are in relationships or whether we are in our working spaces. So by exploring internalized messaging and making nuanced meaning of behavior that other people may be quick to judge, such as maybe like substance use, it is also important to appreciate for a lot of gender and sexual minorities, anticipating rejection is also kind of when our depression and anxiety also sets in. And then there's also the intersectionality of also being in the industry. However, when we're speaking of protective measures, we realize that these feelings are adaptive because it protects us by creating necessary emotional distance that allows safe continuity in our social, romantic, and pleasure relationships. So with my clients, I do ask questions to address depression and anxiety. And with this, I usually ask, where would you like your relationship with your body and yourself to be? How do you want to feel about your body or yourself? What would a peaceful relationship with your body look like? And so these are just some questions that I ask my clients. And why is it really important to discuss these or have these questions regarding our bodies? Because we want to make sure that what we are experiencing in our bodies is not also affecting or being non-conducive to the relationships that we create outside of our bodies. And in practice, I incorporate body scans, which is a guideline for meditation and also for just being present in the moment. Body scans can help rewire our brains after experiencing sexual trauma. It can help regulate our nervous system. It recenters pleasure. It can help with sexual inhibitions, desire, and arousal. And I also like explaining it as sort of like a yin yang model because when we're doing body scans, we're also being attentive to the areas in our body that feel good and the areas in our body that perhaps feel pain or like discomfort. So by practicing this and incorporating it as a daily practice, it can really help with being more mindful and in tune to our bodies and when we are interacting with other people. So kind of like, as I've already said, the greater sense to our bodies. And by creating a greater proximity to our bodies and to ourselves, it can help increase our worth when dating outside or inside the industry. Also, by accepting radical self love in a society in a space that often limits us. So, I want to practice doing a body scan right now. And to practice a body scan, what we'll do is we'll kind of sit down. We'll have our feet to the floor. You can have your eyes closed or you can have them open. And then we'll just kind of like relax. And when we are doing body scans, I like by starting at the very top and then by kind of going down to our feet. So by the top, we'll pay attention to our heads, how they feel on our shoulder. Perhaps there's tensions in the back of our neck, maybe tensions in our lower shoulders. What does our nose feel like? What do our lips feel like? Maybe we had a really long day of talking and communicating and working and our mouths feel sore. Then we're going to go down to our necks and our throats. We're going to feel the vibration cords from talking all day. Go down to our collarbones and to our hearts and into our shoulders. And I'm just noticing that my shoulders are a little tense, so I'm going to drop my shoulders down and I'm going to move them a little bit. Then I'm going to go down to my elbows and my hands. I'm going to wiggle my fingers and stretch them out. Maybe one hand feels tighter than the other. Then we're going to go back and center ourselves at our belly. Feel the breath go in and fill our bellies up. And as we're expanding our bellies, what do these emotions bring us? How does it feel? And then letting our air out. From here, we're going to go down to our pelvis, down to our genitalia as well. If you're a penis owner, you're going to pay attention to those feelings. If you're a vulva owner, you're going to pay attention to those. And then down to our perineum area in our anus. And then we're going to bring our attention to our buttocks, our upper thighs and knees. And I know I was just recently diagnosed with arthritis, so I've been feeling a lot of tension and a lot of pain in my knees lately. So I'm going to bring that down to my calves, um, the bottom of our feet, stretch out our toes. And again, maybe you'll notice here that one foot feels more tight than the other. You can lift your heels up or you can put them back down. And from here, we'll just reflect for a moment. And it's normal to be thinking about many different things and to acknowledge thoughts that kind of go in and out. Just remember, it's normal for us to have busy thoughts as humans and to gently let them go through our minds and out our ears and to recenter ourselves if we can. So just be here for one more minute and then we can come back. All right, and then we'll come back and hopefully you were able to feel kind of like the sensations of maybe the duality, um, anticipating when you are dating that there are feelings of possible anxiety, perhaps remember a time growing up in our families where uh, gender norms and traditions kind of keep playing also within our interactions and communications when we are dating other people. Maybe it was just recently when we weren't accepted into a certain community because of our skin color or our sexual or gender identity. Noticing also times afterwards where we did express happiness and we were accepted in other spaces, knowing that we belong in whatever space that is and that we are not apologetic for our bodies or who we are. And we also are not apologetic if people that we meet aren't accepting of us, because that's on them. It's not on us. Your loss. All right. These are some book recommendations and resources that I have. I really love the book Pleasure Activism by The Politics of Feeling Good by Adrienne Maree Brown. Um, Spanish is my second language, so sometimes I don't pronounce the full word, so I apologize. Um, and then My Body's Not an Apology by Sonia Renee Taylor. There's also The Essential Clinical Care for Sex Workers, A Positive Handbook for Mental Health Professionals by Jamila Dawson, Theodore Burns, and Leah Tannett, who is the founder of Pineapple. And just want to say that we also, at the end of the day, we create our own safety nets with people that we relate to, who help seek out services for us and help advocate for us, whether that be with social workers or close friends. Maybe it's somebody who just really understands how to get health insurance or knows the ins and outs of like Medicaid, which is the Americans, which would be the Americans' version of a subsidized healthcare program. Books that I didn't mention is also The Ethical Slut and Boy Slut. And then for safety nets for activism, so if you do choose so, here in Los Angeles, we have the Sex Worker Outreach Project. This is actually where I met a lot of my really close friends that I'm still friends with today, who identify as DOMs, dominatrix, there are other sex workers, or even OnlyFans creators. I met a lot of them through this organization. They're completely fantastic. They also do a whole lot of events for activism. And while I'm also acknowledging SWAP LA, I want to acknowledge STAR. It was the advocacy and activism group led by Marsha B. Johnson and Sylvia Rivera. So I believe STAR, the acronym for that was for the Street Transgender Action Revolutionaries. Other things that you can do in your free time is to also read biographies. I have here a picture of Adela Vasquez. She was a Cuban American transgender activist and performer. And in your spare time, I also recommend writing and journaling, because a lot of emotions can kind of come up, especially when we are in the dating world, because often than not, our bodies or what we do are very much like not accepted. So, and how to deal with that internalized guilt or shame is to write them on words, right? Because we are our biggest advocates. It is a form to practice self-radical care and love. And it's also a form to kind of like manifestate and create manifestations for the people that we are looking to date and be in these wonderful romantic relationships with. So I am in a relationship right now, and as a Mexican American woman, very um, I was very fearful that I wouldn't be able to meet somebody within my own culture and tradition, since sex work, gender can be very they can be very tight topics within my community. But luckily, I just by doing my own disclosures and practicing also self-love, met someone who practices and also has a lot of the same beliefs that I do within my community. So wanted to add the last tidbit there to end the presentation. Um, so my last slide is for questions. You can also email me at victoria@losangelessextherapy.com. I'm also on Psychology Today, Latinx Therapy, and on media, although I do need to do a better job of going on media, is at Victoria_secrets. So I'm going to stop sharing my screen, and I'm going to kind of come back to the group. Does anybody else have any other questions? There was this one question I wasn't really able to answer, so I'm going back to it. I'm wondering if you can clarify it a little bit. It was express an insecurity about a trick, such as buying you out of the primary or other relationship you have for pleasure. So the way that I interpret this, and it's something that I experienced as someone who worked within the industry, was meeting people who didn't perhaps understand or like the type of work that I did. So oftentimes I was approached by, a couple weeks later, if you stop doing your work, I'll pay your rent, or I'll like pay you out. But for me, sex work and also working with my clients, those were very important to me. So in those instances, I was like, well, this is something I disclosed at the very beginning. If you feel uncomfortable about it, or if you're meeting me with hostility and aggressiveness about it, unfortunately, we cannot move forward with our relationship. So those were sort of the boundaries that I set, and allowing them to consent to either continuing the relationship or not. Did that answer my question? Okay, good. Yeah, it is really important to hold boundaries. And if you are someone who is bisexual or perhaps heterosexual, I noticed that men in particular, who come from also marginalized communities and who are men of color, can tend to have also these sense and feelings of inferiority. So it's not our job as either cis women or as other gender non-conforming identities to explain and also to be there for their healing. These are things that they have to do on themselves, because unfortunately we do live in a post-colonial society that reinforces a lot of these same beliefs, even within our own marginalized communities, especially with perhaps with like cis men. So I wanted to put that out there because it can be discerning, and sometimes you can feel like a sense of like hopeless that I won't be able to meet somebody within my community that has similar beliefs and traditions, but they're out there. They've done the work and they've practiced healing on themselves. So um, I always tell people that they'll come to us. All right. Any other questions? Oh, there is, what resources can you point to? I did have a resource slide at the very end. My resources are more like literary resources, um, seeking out people who have helped inspire me. So, um, resources for partners that want to be better supporters. Uh, I usually I recommend if people do want to get better support in terms of being better partners, I like referring or encouraging them to seek a sex positive therapist that can really um, go underneath what a lot of like these perhaps like misbeliefs and ideas that they have, whether it's multi-generational, whether it's due to trauma or even within the stereotypes that we have currently. Uh, because, like I said, it's not our job to do the healing for them or to do the teaching for them, but whereas pointing them out to sex positive therapists. I'm sure that their sure Pineapple has support for uh, people, support for partners, and giving them literature such as the Safe Slut is also something that I also really recommend. Is it the Safe Slut or sorry, the Ethical Slut? There you go, the Ethical Slut. Thank you, everybody, and I hope you have a great day. Bye.